Hi, my name is Ariana. If you're new here, I'm a full-time grad student getting my master's in nursing as a family nurse practitioner. In this video, I thought I'd go over what it's like to be in clinicals for your OB and pediatric rotation. So I actually purchased the Scrub Life Family Nurse Practitioner Prep Board booklet, and so far it has a lot of good tips, especially for pediatrics and your OB class. It does help with the milestones and has visuals and things like that, feeding schedules, their developmental growth and things like that, and all like genetic disorders that you're going to look out for as a family nurse practitioner, and a lot of common complaints and things like that that pediatric patients will come into the clinic with. So I think this is a very good brief overview of what you're going to be expecting in your pediatric rotation, and I think this is a good resource. Everyone and their mother recommends this resource, and I do as well. I did wait for the Black Friday sale to purchase this because it was about $20 cheaper, and you know, when we're in grad school, every dollar counts. So I thought I'd share this. But some takeaways from my OB and pediatric rotation is we didn't really see many OB patients in our clinic. We saw maybe a few that were in their first trimester and they had flu-like symptoms, so we just treated those. And if they needed antibiotics, we would give first trimester safe antibiotics. And another thing is, when we saw a lot of pediatric patients, we did their wellness visits, which can ultimately take a long time. I did not realize how long these appointments take. They take about an hour because the MA or LVN who's helping you has to do the hearing test, the vision test. They have to do their weight and height and all of that, and generalize a lot of questions that we need to ask, and you know, do the general screenings and things like that as well. So it's a lot of paperwork involved, and also making sure that they're up to date with their vaccines. So we have to go into care, which is what we have here in SoCal, and double check that they are up to date. And if they're not up to date, then we recommend the latest vaccines to get them back on schedule. And you know, with everything up in the air currently, it's really important that you know what vaccines you're supposed to give at what age, and the timing as well, because multiple vaccines will be in 3 doses or 2 doses and things like that. So it's really important that you know that. And ultimately, what I've noticed with the pediatric population is just mainly counseling between you and the parent or the guardian involved in their care. I think it's really important to stress that it's more about education than anything, because again, most people are doing this for the first time if this is their first child, or you know, within that age range and group. So it's really important that you do know not just the memorization of the components of the vaccines and things like that, very robotic. It's just making sure that you're generally giving the proper care and the understanding of what it is and why we're recommending the things that we're recommending, especially screenings as well, like general anxiety, screenings, depression, all of that. It's really important that we relay why we're doing those screenings, and even though it's usually required by insurance companies or the state, it's important to relay that message, because sometimes the questions can be personal as well. So it's really important that we relay those proper questions, and you know, also if they want the parent to be involved in their care, it's also okay. But it's important to it can be a little touchy subject, especially when it comes to pediatric patients, but you as the provider need to be more comfortable in speaking into that type of scenario. So that's why clinicals are so important in this aspect, because you're able to learn and sort of get over that awkwardness and things like that, and you develop a sense of a script, essentially, that you know, okay, this worked with this patient, this worked with that patient, maybe that's a good question to ask and continue and phrase it. Essentially, it's the same question, but you're phrasing it in a way that they understand and that they're more comfortable with. I think, you know, obviously when you go to clinics, especially OB and pediatrics, it's pretty terrifying, because you know, I'm coming with the background of NICU baby catcher in L&D and baby nurse in postpartum. So I know a little bit about the newborn aspect, but when it comes to toddlers and older, I'm a little rusty when it comes to that. That's why something such as this is really helpful, so you can constantly like look back and things like that. And some other apps that are really helpful are like with medications and dosing and pediatric calculation, because everything is weight-based when it comes to pediatrics, and that can be a little daunting as well. But there are resources there to help you, and your preceptor is there to help you as well. And remember that when you're in clinic, it's a structured and supervised aspect of what you're learning as a provider, a future provider essentially. So remember your scope of practice as a FNP. And I think the reason why OB and pediatrics is so intimidating is because they're specialized, right? We just know the overview of the generalizations when it comes to this patient population. But I think what's so intimidating is that it's a lot of information, a lot of questions, you know, a lot of milestones that you need to be aware of, and making sure that the patient is at that age and time. I think that medications, when it comes to it, it's weight-based, so you have to really be aware that the weight is accurate, make sure that it's done every time that they come in, because if you are providing medications, you want to make sure that the weight is current. And I think that's mainly why it's so intimidating, but once you get the hang of it, it's not as bad. I feel, of course, maybe because I'm used to being in the pediatric realm, it's not as bad, and you know, OB patients kind of scare me because you just never know, and most of the time we'll refer out if they are at the first trimester or second trimester, definitely. And we always want to make sure that they're taking their prenatal vitamins, and that they have an OB and everything like that. And also, I'll talk about a welcome baby program that's offered here in SoCal. No one really talks about it, so that's a video that I'm gonna create soon about it and talk about it, because I think it's a great program and not very many people know about it, but I'm excited for that video. And also, you just want to know what type of visits you're encountering, if it's you know, for asthma, or if it's a cold, or you know, a rash or anything like that. You want to make sure that decipher if it's from an allergy, a food allergy specifically, or you know, if it's a strep rash, right? Because I didn't know that you can have a rash with strep, but I saw a patient that did have, a pediatric patient with strep symptoms and the rash. So it's really, I think that's the main thing, is because every symptom can become different on a pediatric patient. It's different, and everyone's different, right? So I think that's another intimidating factor. But you want to be able to build trust quickly with the guardian or parent. Just make sure that you explain everything in detail. Sometimes it can be a little much, but I think if you explain everything that you're doing, okay, I'm going to look inside your mouth just to check everything is good. I'm going to look inside your kiddos at this time, especially with flu season coming. And we saw a lot of sports physicals in the fall because school was starting. So, you know, understanding the sports physicals and, you know, doing a hernia check is super important, because you may miss something, and that's can be a life-threatening thing. So you want to make sure that you're doing your full assessments with sports physicals, especially for the male patients. And, you know, for female patients, you want to make sure that you're asking about their menstrual cycle and things like that. Pediatrics and OB definitely pushed me outside my comfort zone, and I'm definitely a lot more comfortable when it comes to seeing pediatric kiddos and OB patients. But again, this is a great resource regarding OB and pediatrics. Another app that's really good, if your school, I have up to date here, this is like my clinical folder that I've created. You have the USPSTF, which is the Prevention Task Force, and that's something that you can, with your older patients, you can go ahead and implement what screenings need to be done, their age and their weight as well. So you can do that for pediatric kiddos as well. I have the CDC app, which can take me straight to the vaccines if I need it. Usually it's posted in the office, in the room, but if I need to, a quick little glance of, oh, this patient is 18 months or this patient is 5 or 6, I can definitely go ahead and just do a quick glance. And the Sanford guide is the antimicrobial therapy, so this is really helpful when it comes to kiddos and weight-based, because they do have a drug dosing and calculator. And you know, with pediatrics patients, if it is a bacterial infection and we have to prescribe antibiotics, this is a great resource to know which one for that illness and things like that. And this is really helpful because it will break down what medication is best for pediatrics as well as adults. But this is my go-to when it comes to prescribing antibiotics for pediatric patients, because this is up to date, this is evidence-based, and it has the latest essentially medication of what to give for that specific bacteria. And I think that's so important, and it's so critical, especially when a lot of people are giving too many antibiotics and we're becoming antibiotic resistant. So I think it's really, really important, especially as a new FNP, to really stress about antibiotic use with parents, because people are just asking, can I have an antibiotic when it's viral? So it's really important to give that education. But if you must give an antibiotic, the Sanford guide is the go-to. It's always up to date. They do have a student discount. It's 20% off, and I just bought it for the year. And you just need to email them and ask them for the student discount, and they'll give it to you. And I honestly use this for almost every patient, just to make sure that my knowledge is correct with the latest antibiotic, and if I'm supposed to give an antibiotic for that diagnosis. So I think this is a really good double checker for me, as well as asking my preceptor, right? Because your preceptor is always there, but they always say, hey, just look at Sanford guide, is that the latest and what we're supposed to give. So I think that's a really great resource, as well as the Sanford guide, because it does help give you the accurate medication and dosing as well. So I think that's important. And other than that, I think mainly just go in as confident as possible. I know that's easier said than done, but at the end of the day, you're there to learn, and your preceptor's there to help you. But any other OB or pediatric questions, feel free to leave them in the comments. And until next time, bye.